So how we can decide whether the patient can go for return to sport? Okay, first they should have completed the neuromuscular training. Okay, and the quadriceps strength should be more than 90%. So that means you succeeded with the perturbation training, neuromuscular training, everything is proper. The patient is in a good thing, so that the quadriceps strength and hamstring strength are more than 90% when compared to the contralateral thing. Then you can start with the focus on the sport specific reintegration and into the desired level of activity. Okay. Again, when during the previous phases, when the patient some psychological support, they feel like I am not confident on doing the optics or something, initially we go with the knee brace. Sometimes they wear the knee brace and do the activities. As they become more familiar, we remove it. Okay, yeah, there may be some support, the stability is there. That depends on the therapist. Okay, some patient, when they are not very confident on doing that perturbation thing or something, you can give the knee brace, make them master with the knee brace, then you can wean off the brace, and then you can give the thing to do the stability. Because at no point don't try to leave it when the patient is getting good amount of strength, because when the range is there, effusion is gone, they are going to be a good candidates for the rehab. So knee brace you can give at the early stages, just for the enhancing the stability. Okay, so the knee joint, again I told CKC, OKC, the combined thing is having more effect thing. And we can start with the some of the agility tasks. We usually begin with the straight line at the submaximal speed. Then we can progress with the increased intensity of movement, and then the more dynamic directions. So this we have to remember. Okay. So when we think of return to sport, is this criteria should be there, and we can have the neuromuscular training. Minimum 10 session of the thing they should be completed. Okay, and the perturbation they can able to do, because when they can able to do the perturbation washing, then they on field or this sport specific training, they will be progress very nicely. And return to sport decision making. So you can do the training after the 3 months of this thing. And what decision making I can do for the return to sports is again the same thing: isokinetic assessment of the quadriceps and hamstring. Functional aptitude index should be 80% or 90%, and the psychological readiness return to the sport. The player should be confident. Yeah, I am ready. I'm going to perform my sports well because my knee is stable. Okay, so these three things is there. And ideally, I used to do this one of the thing called tuck jump assessment. So what happened when the patient is with the thing? See, this we can take this tuck jump assessment I use in two aspects. One, pre-injury screening. Injury prevention you want to do for some athletes. When the thing, you can see the assessment, you can do some scoring, and then you can say, yeah, based on the assessment factors, he may prone for injury. Fine. After the rehabilitation, we found some of the thing, like what are those things I'm going to tell about the tuck jump assessment. If you feel some of the factors out of the 4 factors, some factors is there, maybe instead of giving to the return to sport, you just train addition in based on the tuck jump assessment, then you send for the return to sport. So what are the things I do in the thing? So there are 4 factors, neuromuscular factors, you have to concentrate when you do the tongue chip assessment. What commonly will happen when they are in the contact or non-contact sport, that doesn't matter. We just make the patient to hop from a thing, and they have to land on the ground. From height, we make them to jump. Tuck jump they are going to do, and that assessment we are going to do. From height, they are going to jump. Okay, so what will happen? What are the common neuromuscular factors or abnormal things it will happen? When they jump, landing is normal. Without these 4 factors, then I can say, yeah, they are the proper candidates. But when they have some excessive knee adduction, that means the athlete is landing with excessive knee adduction, then I can say the ligament is more dominant, that is taken more of the adduction force during the landing, and they may land up with some noise on the ground. It's not something noise on the knee. They will, that means the leg will touch with a very high sound. The noise on the ground will be more with excessive knee adduction. When these features are there, then we think like, yeah, there is a ligament is dominant. That means the proper force is not happening in the knee. We have to train for the proper technique, balancing of the medial lateral structures, and then the some of the activities, balance activities we have to do when there is a quadriceps dominance. So what will happen is the quadriceps, as I told before, it is going to give the excessive anterior translation. Okay, the ligament and the other structures are not ready to take the load. Okay, so what will happen when they land? There will be some amount of knee flexion is observed during the landing. When the quadriceps is working more, there will be very reduced knee angle. Okay, less than 5 to 10 degrees is observed in the studies. Okay, so they land with almost the extension. So when they keep on landing with the extension more without knee flexion, what is happening? The quadriceps is giving excessive anterior translation more. That is giving more strain on the ACL, and the posterior chain thing is not working properly. So in this thing, you have to try to avoid the quadriceps dominance by balancing the posterior chain, like gluteus, hamstrings, and calf thing. If you strengthen, this quadriceps dominance will become less because of this activation of the posterior chain, and that may lead to normal flexion angle in the landing. So this is one of the thing. And what you see in the leg dominance is nothing but when you see the very minute video analysis, they always land with that leg first. Ideally, when they are jumping and going to land, both the legs should touch at the ground at the appropriate time. But here, when the leg is more dominant, maybe the dominant leg or the leg which is going to be injured, we suspect, they always try to touch first and they take more load on the thing. The balance of the thing, it's not there. So for these people, we have to train the side to side symmetry so that the leg dominance will become more, the ACL injury will become less for these people. And last one is trunk dominance. What they do here, because they can't able to control the center of mass, after landing, they just try to lateral flex more on the side. Okay, so what is happening when the center of mass is not proper? Again, that may lead to some excessive stress on the knee because they try to land with the trunk flexion more during the thing. So here you have to give the perturbation training and core stability training, and this we have to balance to prevent this. So these four factors, when you assess when there is a excessive knee landing due to ligament dominance, or low flexion angle due to quadriceps dominance, or when they go with the one leg touching the ground first, leg dominance, asymmetrical landing, or when they go with excessive trunk flexion, even you rehab or following a reconstruction or the pre-injury, these people are again more prone for the problem of ACL again. So these are some of the neuromuscular factors, and you have to address this before sending to the sports, or when they are already in the sports, you have to address to prevent the injury. So these four things you have to remember. This is very, very important.